High blood pressure patients often worry that exercise might worsen their condition. However, properly planned and scientifically sound workouts can actually help improve blood pressure, boost fitness, and enhance overall quality of life. This guide explains, from 3 critical perspectives, how to determine if you can exercise, what type of exercise to choose, and how to exercise safely, ensuring every workout is a powerful step in safeguarding your health. Assessing your condition, are you ready to exercise? Before starting any exercise routine, the most important step is to consult your doctor to gain a clear understanding of your blood pressure control and overall health status. To help you assess the risks associated with exercising, high blood pressure is typically divided into 3 levels. 1. Mild hypertension, steady progress. For patients whose systolic blood pressure ranges between 140 and 159 mm Hg and diastolic pressure between 90 and 99 mm Hg, with blood pressure well controlled on a daily basis, moderate, orderly exercise is usually safe and may even help improve circulation. Case in point, Mrs. Johnson, 67, has maintained a blood pressure of around 145/95 of a millimeter Hg. With her doctor's guidance, she incorporates morning walks and practices Tai Chi. Within a few months, she noticed improved sleep quality and a brighter mood. For individuals in this range, regular moderate activity can help lower blood pressure and might even reduce the need for medication adjustments. 2. Moderate hypertension, cautious experimentation with professional guidance. When blood pressure reaches 160 to 179 mm Hg, or diastolic levels of 100 to 109 mm Hg, even if medication has stabilized it to some degree, extra caution is necessary. Clinical record: Mr. Anderson, 70, had experienced significant fluctuations in his blood pressure and began treatment about 6 months ago. With strict monitoring in place, his doctor recommended that he gradually introduce low-intensity aerobic exercises, such as brisk walking and gentle cycling in the park, under the supervision of a professional rehabilitation trainer. This gradual approach not only bolstered his cardiovascular fitness but also minimized the risk of adverse reactions due to unstable blood pressure. 3. Severe hypertension, extreme caution required. For those whose systolic pressure is 180 mm Hg or higher, or whose diastolic pressure is 110 mm Hg or above, exercise is generally not advised unless under tight medical supervision. At this stage, the body's hemodynamic state is highly sensitive, and sudden shifts during physical activity could trigger complications. Warning example: Ms. Thompson, 75, had long neglected regular blood pressure checks, leading to frequent spikes around 185/112 of a millimeter Hg. When she once tried a solo morning run, she experienced slight discomfort that quickly escalated into dizziness, nearly causing her to faint. After proper medical intervention, she switched to gentle indoor functional exercises, strictly monitoring both the duration and intensity of her sessions. For patients in this group, any exercise regimen must be undertaken only with the close oversight of a healthcare team. In summary, only if your condition is deemed stable should you begin planning an exercise routine. Regular monitoring of blood pressure and bodily feedback is essential to ensure that your workouts remain both safe and beneficial. Devising an exercise plan, choosing the right activities. For hypertensive patients with well-controlled blood pressure, selecting the appropriate type of exercise can make your workouts both enjoyable and effective. Different forms of exercise offer unique benefits, and the following are several recommendations suitable for most patients. 1. Prioritize aerobic exercise, activate full body circulation. Aerobic exercise is the most commonly recommended form of physical activity. Its primary benefit lies in delivering a steady, sustained load that improves cardiopulmonary function and boosts overall blood circulation. Recommended activities: running or brisk walking. Utilize safe trails in local parks or neighborhoods, aiming for 30 to 40 minutes per day. This will moderately elevate your heart rate without causing undue shortness of breath. Tai Chi and yoga, ideal for older adults. These gentle exercises coordinate breathing with smooth movements, reducing emotional stress that might otherwise impact blood pressure. Cycling, whether it's outdoor biking or using an indoor stationary bike, cycling at a relaxed pace can strengthen your legs and enhance your cardiovascular endurance. Example in action: Mr. Brown, 69, keeps his blood pressure around 150/95 of a millimeter Hg by alternating between morning runs and easy-paced walks along a lakeside trail. After 6 months of this dual approach, he has not only lost weight, but also reported enhanced mood and improved memory. 2. Incorporate strength training, enhance body stability. In addition to aerobic activities, moderate resistance training can help build muscle strength and improve flexibility, which indirectly aids in blood pressure control. It's crucial that such exercises be performed under professional guidance to avoid holding your breath or applying excessive force during movements. Recommended exercises: simple push-ups and squats. Use your body weight for basic exercises. These can be done at home with the support of a wall or a sturdy chair. Dumbbell and resistance band workouts. Opt for lightweight equipment to perform exercises that target both upper and lower body muscles. Aim for 8 to 12 repetitions per set, 2 to 3 sets per session, with sufficient rest between sets to gradually build muscle endurance. Real-world example: Ms. Wilson, 68, following 6 months of a doctor-prescribed strength training regimen, has seen noticeable improvements in both her posture and balance. Coupled with regular leisurely walks, her overall blood pressure has stabilized significantly. She finds that these light muscle-building exercises also make daily tasks, like climbing stairs or carrying groceries, much easier. 3. Embrace exercise variety, a holistic approach to health. Managing high blood pressure isn't solely about one type of exercise. A balanced mix of activities can prevent the monotony and physical fatigue that sometimes accompany repetitive workouts while stimulating different systems in your body. For instance, you might perform moderate-intensity aerobic exercises on weekdays and reserve gentle strength or flexibility sessions for the weekend. This variety allows your body to adapt more comprehensively to exercise stress, keeping your routine both engaging and effective. Overall strategy: the best exercise routine will depend on your personal interests, physical abilities, and your doctor's advice. Balancing enjoyment with effectiveness is key to sustaining a long-term, healthy exercise habit. Managing exercise intensity and frequency. Once you've identified the appropriate types of exercise, the next step is to regulate your workout intensity and frequency. Exercising too much can overburden your heart and blood vessels, while too little exercise might not achieve the desired health benefits. The following points can help you strike the right balance. 1. Moderate load, increase gradually. The ideal exercise experience should leave you slightly sweating, with an increased breathing rate that still allows for easy conversation. Experts suggest that each session last at least 30 minutes, aiming for a total of 150 or more minutes of exercise weekly. New experience narrative: Mr. Harris, 72, takes a brisk 35-minute walk every evening along his neighborhood path. Although he initially experienced slight palpitations, under the guidance of his trainer, he adjusted his pace and now walks without gasping for air while still being able to chat normally. Over time, his blood pressure has significantly decreased, and his weight and body fat have both moved closer to ideal levels. 2. Controlled movement, avoid sudden fluctuations. Maintaining a steady emotional and physical state during exercise is crucial for high blood pressure patients. Sudden surges in intensity or rapid, forceful movements can cause sharp increases in blood pressure, leading to dizziness or chest tightness. It is best to gradually progress from low intensity to moderate or higher intensity workouts, never rushing into strenuous activities. Health reminder: begin each session with a 5 to 10 minute warm-up, such as light stretching, and allow an equal amount of time for a cool down afterward. This practice helps normalize your heart rate and blood pressure slowly, significantly reducing the risk of acute exercise-induced issues. 3. Consistent frequency. Spread out workouts throughout the week. Instead of concentrating all your exercise into 1 or 2 long sessions, it's more effective to engage in moderate movement daily. This keeps your heart working steadily without being overwhelmed. Effective strategies include daily moderate exercise. Aim for 30 to 45 minutes of activities like walking, jogging, or home fitness routines each day. Alternating resistance training. If including strength training, perform these exercises every other day to give your muscles ample recovery time. Mixing modalities. Alternate between aerobic and resistance sessions to optimize blood pressure regulation and overall fitness. Many patients have found that a daily, regular exercise routine combined with proper rest not only boosts their physical stamina but also helps stabilize their blood pressure. Furthermore, such a consistent lifestyle positively affects mental well-being, enhancing the overall outcome of hypertension management. Exercise safety guidelines, precautions and helpful tips. Safety should always come first. Here are key guidelines to follow during your workouts to ensure you exercise safely while reaping maximum benefits. Don't hold your breath or strain during resistance exercises. Maintain even breathing at all times. Holding your breath can cause a spike in internal pressure, potentially leading to irregular blood pressure fluctuations. Avoid sudden direction changes or exertions. Rapid shifts in movement or burst exertions may trigger dizziness or chest pain. Even if you're familiar with an exercise, always make gradual transitions rather than sudden sprints. Heed warning signs. If you experience a rapid heartbeat, chest tightness, dizziness, excessive sweating, or muscle cramps during exercise, immediately slow down or stop and rest. If these symptoms persist or worsen, seek medical attention without delay. Stay hydrated and maintain energy. During your workout, keep water nearby and consider low-sugar energy drinks or fresh fruits. This helps prevent dehydration and provides a quick energy boost without spiking your blood sugar. Monitor regularly and adjust accordingly. Check your blood pressure and heart rate both before and during your workout regimen. Based on how you feel and the readings, adjust your exercise intensity and duration to stay within safe limits. Safety in practice. Mr. Davis, 68, follows a strict routine of warming up, executing his main exercises, and cooling down afterward. Even on days when the weather is unpredictable, he checks his blood pressure before heading out and stops immediately if he feels off, consulting his doctor if necessary. His cautious and disciplined approach has enabled him to exercise effectively while maintaining stable blood pressure. These safety protocols are essential not only for hypertensive patients but for most older adults. Remember that each exercise program should be tailored to your individual capabilities. Always exercise within your limits and progress gradually for long-term benefits. Making exercise a lifelong habit for better health. When managing high blood pressure, exercise isn't just a treatment, it's a lifestyle. By accurately assessing your health status, choosing appropriate activities, and regulating workout intensity and frequency, you can safely improve your fitness, mood, and blood pressure control. Additionally, a regular exercise routine brings many unexpected benefits, such as weight management, improved mood, and enhanced sleep quality. Always remember that your exercise program should be designed in collaboration with your doctor or healthcare professional. Regular checkups, diligent monitoring of your blood pressure, and ongoing adjustments to your routine in consultation with your medical team are the keys to long-term success. Let's embrace the joy of physical activity while building a healthier, more energetic future for ourselves and our families. May every gentle walk and every mindful stretch empower you to protect your health. Let scientific exercise ignite your vitality, and may each drop of sweat lay the foundation for managing blood pressure steadily. After all, a healthy life begins with every safe and well-planned workout.